Good afternoon. On behalf of the NIH Office of Disease Prevention, it is my pleasure to welcome all of you to today's event from our Prevention in Focus webinar series. This is our fifth and final webinar of 2024, and we are very excited about today's presentation. My name is Valerie Robinson, a health science policy analyst here at ODP, and I will be serving as the host for the session. So as a background, first launched in 2021, this webinar series was intentionally conceived for the purpose of providing a space to hear directly from prevention research experts and thought leaders whose work is driving impactful advances in the spaces of prevention research and public health. Today, we are delighted to have Dr. Laura Iannotti from Washington University in St. Louis deliver a presentation titled Global Food Security, Research to Inform Evidence-Based Policies and Practices. Next slide, please. Before we begin, I would like to go over some logistics for today's session. As attendees join the Zoom today, the audio lines were muted, and these lines will stay muted throughout the session. Also, please note that this webinar will be recorded, and an archive recording will be posted to ODP's Prevention in Focus website and also made available on our YouTube channel within the upcoming weeks. There will also be a question and answer session at the end of the presentation, and as stated on this slide, please feel free to submit any questions you have to the chat pod and direct them to host and panelists. Also, at any point, you may use the chat pod for general commentary, questions for the speaker, or to request technical assistance. We do have an amazing staff at ODP who are closely monitoring the chat and working hard to ensure appropriate engagement with our speaker today. Next slide, please. And with that, I know we're eager to hear today's presentation. So at this time, I would like to introduce Dr. Daniel Rayton, who will provide some remarks and then introduce our speaker for today's webinar. Dr. Rayton joined the NIH Office of Nutrition Research in October 2023. And prior to joining ONR, Dr. Rayton served as the Program Director for Nutrition at the Eunice Kennedy Shriver National Institute of Child Health and Human Development, that's NICHD, from 2009 to 2023, where he was responsible for the portfolio of grants and related activities to support and advance the maternal and child health nutrition agenda in the U.S. and globally. His career has focused on the interface between research and translation to support evidence-informed practice, programs, and policy in food safety and nutrition. He first joined NICHD in 1999, where he began his service in the Office of Global Health. Dr. Rayton has a Bachelor of Arts in History and Political Science, and a Bachelor of Science and Master of Science in Animal Health and Agriculture, and a PhD in Human Nutrition from Penn State University. And he also completed a postdoctoral fellowship at the Yale Child Study Center. Welcome, Dr. Rayton.
Thank you. I think you could have abbreviated by saying that. I'm just old. I've been around a long time. Thank you, Valerie, and thank you to everybody at ODP. I'm really delighted to have the opportunity to introduce Laura. I've known Laura for at least 15 years, maybe closer to 20. My experience of her has been a perseverant researcher, a dedicated teacher, and mentor. She has navigated the research waters and the challenges of getting funding for this very important area of research that she's going to talk about today. And I'm sure her comments will be not only informative, but inspirational. Laura's just a tremendous asset and gift to the community. So with that, Laura, take it away.
Good morning, everyone. Good afternoon, evening, wherever you are. Thank you so much for this invitation to participate in this Prevention in Focus webinar series. Prevention science is central to the discipline of public health and crucial for human well-being. WashU is preparing to launch a new school of public health, our first new school in 100 years, in recognition of this. So today I'll be talking to you about global food security and research to inform evidence-based policies and practices. My lab, the E3 Nutrition Lab, does research on maternal and young child nutrition to derive and test innovative prevention solutions that embrace each of these three E's: equity, evolution, and the environment. We do community-based trials, intervention trials, in Ecuador, Haiti, Kenya, Madagascar, and more recently in St. Louis, Missouri, and then bring these findings up to the global level to influence policy and guidelines with the World Health Organization, Food and Agriculture Organization, and UN Nutrition. So this afternoon, what I would like to present to you is first start by giving you an overview of the global food insecurity situation. And I appreciate you showing up and caring about this problem. Specifically, I'll talk to you about nutrition in the first 1,000 days of life. Then I'll give you an overview of findings that we had in a comprehensive review for evidence-based policies and practices around the different domains of food environment: availability, affordability, diet quality, and food promotion. In the third part of the presentation, I'll introduce you to some of our projects in Haiti, Ecuador, and Kenya, and then conclude with some ideas and thoughts about how to translate this research into policy and practice. So around the world, 1 in 5 young children experience stunted growth, or a form of malnutrition that's chronic and related to poverty and infectious diseases. 45 million young children are wasted with acute malnutrition. 2 billion people are overweight and obese, and 2 billion people experience hidden hunger or nutrient deficiencies due to a lack of access to high-quality foods. Essentially, 1/3 of our world is well-nourished and 2/3 is malnourished. We have made progress on the World Health Assembly nutrition targets, but a good deal of distance remains for such problems as exclusive breastfeeding, stunted growth, and anemia. Stunting in young children is defined as low height for age Z-score less than -2, according to the WHO growth standards, and it disproportionately affects countries around the world. So those in pink shading have the highest levels of stunting concentrated in sub-Saharan Africa, Southeast Asia, and Oceania. But this masks the stark disparities that exist within countries. In some of the communities that we work in, Ecuador and indigenous communities, stunting prevalence can go as high as 75%. Probably as many of you all know, nutritional needs vary across the life course, and there are some that are more vulnerable than others. We know that nutrition in the first 1,000 days of life is extremely important for prevention. Evidence is also growing on the vital need for other phases like school age and adolescence, as well as older adults for cognition, sarcopenia prevention, and frailty. We have known for many years that malnutrition exposures in that first 1,000 days of life, from conception through 2 years of age and beyond, will have lifelong consequences if the child survives, of course. So this recent analysis confirms that assertion. Data was compiled from 32 cohorts from low and middle income countries. You can see that evidence of the incidence of stunting from birth, 0 to 6 or 6 to 15 months, shows plateauing or declining trends. Reversals are rare. And in cases of reversal, relapse risk is very high. Stunting incidence at birth is highest in South Asia. But we also know that nutrition-dependent processes continue through the life course, in particular, brain development. In this paper that we published with my med school colleagues, we illustrate that by 2 years of age, a child's brain is structurally similar to an adult brain. Myelination, which may be dependent on iron nutrition, for example, continues to rise into adolescence and then plateaus. This recent study compiled 100,000 MRI scans from 100 studies around the world, and it examined the growth trajectories of different parts of the brain, also sometimes dependent on nutrition, gray matter, white matter, subcortical volume, and they all seem to converge at 6 months. Again, in those first 1,000 days of life, in the vital importance of that period. So nutrition effects on brain development, there are particular nutrients that participate in different processes that we know if absent in a child's diet, those processes can go wrong. So docosahexaenoic acid for neurogenesis, neurotransmission, myelination, synaptic plasticity, iron for dopaminergic function, myelin production, hippocampus striatal function, zinc and choline for all of these processes that I have listed here. My lab studies these nutrients because they are found bioavailable in animal source foods, and they're very important and can be deficient in many populations around the world. Okay, so turning back to some of the key drivers of global food insecurity, we know that poverty and economic shocks has led to high levels of food insecurity. 3.1 billion people around the world cannot afford a healthy diet. And of course, the pandemic led to food insecurity. Armed conflict and political instability today is leading to high levels of food insecurity in many countries around the world, where food might be used as a weapon of war. Climate change, drought, flooding, hurricanes, extreme weather events is increasing food insecurity, especially in vulnerable populations like low and middle income countries. On the other side of the equation, however, our food systems are also contributing to climate change and leaving environmental footprints. It's very important to recognize this. So approximately 30% of greenhouse gas emissions comes from food production, 70% of fresh water withdrawals, and 40% of land use. And yet, almost a third of all food around the world that is produced is wasted. There are differences by food type in terms of the footprint left. So ruminant meats, for example, are highest in terms of greenhouse gas emissions. Pond and farmed crustaceans are highest for blue water, and low chain animals can be good for the environment. So forage fish, bivalve mollusks, and insects have relatively small footprints. Now, these environmental footprints again vary by income level of countries. In high-income countries, food production systems seem to have a greater effect on climate change. Another disturbing trend that I really want to call your attention to is the increasing homogenization of food supplies. So only 3 plants, rice, maize, and wheat, comprise an estimated 60% of calories globally. FAO estimates that 12 crops and 5 animals provide 75% of the world's food supplies. But our variation since 1960 is diminishing and going down. And this is leading to concurrent losses and related losses in both biodiversity and diet diversity. So as I mentioned, my lab focuses on animal source food production, animal source food access and consumption, because many populations do not have access to these high quality foods. And it's extremely important in the first 1,000 days of life, because those nutrients are provided in bioavailable matrices that are more efficiently absorbed by young children. But again, you can see that there are global disparities in ASF consumption, with sub-Saharan Africa showing the lowest, as well as Southeast Asia, Europe, and high-income countries showing the highest. This figure comes from a report that my lab worked with FAO on to look at the importance of terrestrial animal source foods and health outcomes. And once again, it shows that even if we just look at low and middle income countries, that the percentage of children, there are great disparities of percentage of children between 6 and 23 months consuming terrestrial animal source foods. Big differences between the poorest and the wealthiest quintiles. Okay, so I'd like to transition now into a review that we did on evidence-based policies and practices. I'll probably move through these slides relatively quickly. just to give you an overview of the complexity of this problem and how important it is to think about food security holistically. This agri-food framework, which draws on Turner et al. And Downs et al., portrays the different elements or domains of food security and the food environment, including food availability, food promotion, diet quality, and food affordability or food prices. Undergirding these food domains, food environment domains, is sustainability, which should include environmental, economic, and social sustainability. I wanted to include the NICHD Bond Kids framework too, to illustrate the value of nutrition ecology and how complex nutrition can be throughout the life course. This framework shows the importance of thinking about this from cells to society, from proximal environmental drivers to distal environmental drivers. And this was published by Dr. Rayton, who did the introduction, and Dr. Maureen Black, who led our working group for this initiative. So what we found in our review in terms of food availability is that global massive investments in staple foods, again, going back to the homogenization of our food supply, is occurring. And this, again, has implications for human nutrition, low quality foods, and the environment, for example, in monoculture. Fiscal subsidies and price incentives for food producers occur in middle and high income countries, whereas social protection policies tend to occur in low income countries, as well as school feeding programs and consumer price controls. Where we have gaps in the evidence is for agroecological approaches across different domains, such as horticulture, agroforestry, aquaculture, and fisheries. We're not investing in women and smallholder agriculture, despite producing greater than 75% of our food. Pastoralism is practiced on 25% of land and yet not supported. In terms of food affordability, sometimes called food access, one of the key findings from the review was the preponderance of evidence is in support, again, of social protection policies, such as conditional cash transfers. Fiscal measures are used to incentivize healthy foods in middle and high income countries, whereas we might have food aid programs in low income countries to subsidize the cost of high quality foods. Food promotion. In the review, we focused on food promotion as it relates to social and behavior change, and found that, in fact, there's important processes as part of social behavior change that include audience segmentation, targeted messages, appropriate channels, and trusted information. Public information campaigns have not really been studied, but are thought to be effective in terms of, but are thought to be ineffective without food access. And finally, diet quality, which is a good transition into the research of my lab. Diet quality is defined as the nutritional value, safety, and freshness of food items resulting from diet quality in terms of diversity, adequacy, moderation, and overall balance. One of the key findings is that diet quality considerations are especially important during particular phases of the life course, complementary feeding and pregnancy and lactation. Food-based dietary guidelines, as you can see in some of these pictures to the right, generally include 4 elements: health-based considerations, nutrient and energy intakes, dietary behaviors, but they don't always include sustainability or foodborne contaminants and relevance for special population groups. There are also critical gaps in the evidence for dietary diversity, though recognized in food-based dietary guidelines. Okay, so now moving into a few slides to introduce you to the research of my lab and to illustrate the importance of community-based, rigorously designed trials to generate evidence for program intervention and policies. Some years ago, we conducted the Laloon Project, which was a randomized controlled trial to test 1 egg per day for 6 months. in young children starting early in the complementary feeding period from 6 to 8 months of age. And we showed that this intervention, 1 egg per day for 6 months, increased linear growth by 0.63 length per age Z-score and reduced stunting by 47%, a really big effect size. You can see the panel on the right, the egg group, shows that public health impact in which the entire distribution shifted to the right. All kids were growing closer to their development, their growth potential. And then supporting or triaging or validating these growth findings, we also showed that the egg intervention increased by large effect size choline concentrations in the blood by 0.35 and docosahexaenoic acid concentration in the blood by 0.43. Now, this trial led to several replication studies around the world, including one that was funded by NICHD, and R01 by my lab. It's called Grande Bien. Each of our trials have names that are in the language used in the community. So this is in Creole. Grande Bien means grow well. Here we're targeting urban poor young children in Cape Haitian in the north. So thankfully somewhat protected from the upheaval and political conflict in Port-au-Prince. The design of this trial, again, in aspiration for being, for having credible causation findings, is a randomized controlled trial. It's a 3-arm longitudinal study. In the first group, group 1, we have control. In the second, it's the egg group, 1 egg per day. And then Grande Bien adds a parenting intervention to see if we can improve developmental outcomes in young children. So our aims were to demonstrate the reproducibility and feasibility of the egg intervention on stunted growth and development. Aim 2 was to investigate the incremental benefit of Grande Bien. And then in aim 3, we are looking using mixed methods at various impact pathways, the biological ones, nutrient biomarkers, bone age using ultrasound, a field-friendly ultrasound protocol, and enteric disease, psychosocial outcomes, as well as environmental factors. In the second study, which is just finished, this is called Mikuna, and this means nourish in Quechua in the local language. This was conducted, in Ecuador, also a randomized controlled trial targeting a mixed indigenous group of pregnant women. And in this trial, we wanted to go back even further into the 1,000-day period so that we could look at how nutrition and dietary patterns explicitly influence fetal brain development. Again, using that field-friendly, non-invasive ultrasound protocols. We intervened in the 2nd and 3rd trimesters of pregnancy with an evolutionary diet or a dietary pattern adapted to the Ecuadorian context, using fish, eggs, and a variety of fruits and vegetables. And our aims were to compare the efficacy of this dietary pattern on fetal and newborn linear growth. We examined the metabolic pathways to mitigate fetal newborn growth outcomes, and then finally characterize the change in fetal newborn brain morphology using field-friendly techniques. Some of our preliminary findings, not yet published, are that the intervention showed a greater growth in subcortical structures of the corpus callosum and the gangliothalamic ovoid, as well as improved maternal nutrition status of DHA. This study was funded by the Children's Discovery Institute. And finally, I want to introduce you to our trial, Samaki Salama, which means secure fish in Kiswahili in Kenya. And here we targeted small fishing households in rural coastal Kenya. Small food producers tend to be, ironically, the most malnourished and poorest populations around the world. In this community, they were largely selling their fish, no surprise, this often happens, and using the proceeds to buy maize. This was a cluster randomized controlled trial. We had a control group, a social marketing for nutrition behavior change group to encourage families to give a little bit of the fish to the young children, some of the take-home catch. And then the third arm was a social marketing plus a modified fishing trap intervention. And you can see the modified trap in the picture on the right, which has an escape valve, and that allows the juvenile fish to escape, thereby protecting the marine ecosystem. So this was one of the objectives of this project, was to protect marine ecosystem health as well as child health. We compared the efficacy of this 12-month bundled intervention on young child growth, and we examined for 3 different impacts: fisheries yield and biomass, fisheries earning, and changes in diet diversity and fish consumption. And these findings, we achieved a win-win-win. So again, to reinforce the importance of an integrated approach targeting multiple determinants of young child nutrition in the first 1,000 days of life. We improved young child nutrition, so increased height for age Z-score, we increased income and improved livelihoods, and we improved markers of ecosystem health. This trial was funded by the USAID Feed the Future Innovation Lab, and I'm going to show you just 2 more slides with those findings. So again, regression analysis using difference in difference analyses showed significantly improved height for age Z-score, improved diet diversity, and child fish consumption. And here I'm showing you the results from the sustainable fisheries and livelihood findings. We increased fish length. Fish were growing to more maturity and species richness, which can be used in tandem with diet diversity indicators. We increased biomass revenue and catch value, and we increased the concentration of nutrients in the catch, including protein, omega-3, calcium, iron, selenium, and zinc. And importantly, you can see in panel G, we had a huge effect on take-home catch. So families were taking, the small fishing households were saving some of that catch for the young children. Okay, so moving into the conclusion. I'd like to summarize by saying that food insecurity, global food insecurity, and hidden hunger affects communities around the world differentially. There are key drivers that include poverty, conflict, and climate change. Protecting nutrition and stunting prevention in the first 1,000 days of life is crucial for preventing and protecting multiple health outcomes. Evidence across the food environment domains suggest integrated approaches that target food availability, affordability, diet quality, and promotion can effectively and sustainably mitigate food insecurity. Research in low resource settings from my lab and others point to solutions for preventing malnutrition during that crucial life course phase. Now, on the horizon, we can't stay still and not allow this evidence to be translated into action. So, to highlight some of the translation opportunities, the WHO published complementary feeding guidelines just last year that include some of these recommendations, such as animal source foods during the complementary feeding period, in the context of a healthy, diverse diet. Again, the FAO report that I mentioned earlier on the contribution of terrestrial animal source foods to health outcomes. Evidence can be translated into food-based dietary guidelines, and integrated strategies to prevent stunting across contexts is needed. From my point of view, more research is needed to look at dietary patterns that are adapted to local contexts on early growth and brain development in particular. I think in terms of the global food security situation that we have an opportunity with international comparative analyses to understand contextual barriers and opportunities. And then finally, approaches to linking agroecology through horticulture, agroforestry, fisheries, and aquaculture can lead to improved diet quality and diversity, and we need to study that and invest in that. So with that, I'd like to acknowledge my fabulous teams across these multiple countries, the funders, as well as my partners, institutions in these countries. and say thank you very much.
Thank you so much, Dr. Iannotti. That was a very fantastic presentation. So before we transition into the Q&A session, as a reminder to our attendees, please continue to submit your questions to the Q&A pod directed to all panelists. And then I do want to also mention again that this webinar is being recorded, and the archive recording will be posted to ODP's Prevention and Focus website and also made available on our YouTube channel. So as you continue to think about your questions, we do have a couple of ODP specific and NIH announcements to share. So I do want to take this time to ask that you be sure to subscribe to receive our email updates, which will inform you of our 2025 Prevention and Focus webinar presentations, which have yet to be announced. Next slide, please.
Ooh, sorry.
And then we have our ODP Methods Mind the Gap webinar series presentation titled Designing Multi-Level Interventions to Eliminate the Impact of Harmful Social Determinants of Health. This will happen virtually on Thursday, December 5th at 12 p.m. Eastern. And we're pleased to have Dr. Guillermo Ramos from the Johns Hopkins School of Nursing joining us. So please feel free to register for that exciting presentation. Next slide, please. And then I want to draw your attention to our menthol challenge. So also in partnership with the CDC, we have launched our Quit and Thrive Menthol Challenge, which focuses on community-derived solutions to reduce menthol cigarette smoking among groups with disproportionately high rates of menthol cigarette use. So organizations are invited to submit entries illustrating what has worked for their communities. The submissions, they opened on November 1st, and they run through a deadline of February 28th, 2025. You can visit the link here for further details. And I also do want to note that there is a pre-submission webinar that is happening on December the 18th at 2 p.m. Eastern. So you'll find all of that information at the link to register for that and get your questions answered prior to submission. Next slide, please. And our final announcement is from our colleagues over at the NIH Fogarty International Center, who are hosting a supplement launch webinar on learning from global food and nutrition insecurity across borders. This is to explore best practices and strategies across the lifespan and also bring forth opportunities to address these issues globally. And the registration link is there in case you want to grab a quick screenshot of this information. And then on to the next slide. If you have any questions, feel free to reach out to Dr. Susan Vorkerper at FIC if you have any comments or questions. And the next slide. So now I will briefly introduce Ms. Brahma Kautha, who will moderate our Q&A segment. Brahma Kautha joined ODP in December 2020. She coordinates trans NIH disease prevention and collaborative research. Ms. Kautha strengthens disease prevention partnerships to address health equities and the primary risk factors for morbidity and mortality. And prior to joining ODP, Ms. Kautha was a HRSA project officer and public health analyst, where she created funding opportunity announcements, maintained academic grants, and advised grantees. She's also worked with internal and external stakeholders to educate staff on prevention-focused nutrition as a clinician, registered dietitian, nutritionist. Ms. Kautha has also been a senior program analyst at the USDA, where she has supervised national child nutrition programs and advised state and local governments. She has additionally created training grants and cooperative partnerships to implement the Healthy Hunger-Free Kids Act. Welcome, Ms. Kautha. The floor is all yours for Q&A.
Thank you, Valerie, and thank you, Dr. Iannotti. Great presentation. I see a comment here saying that the work is truly inspiring, making a real difference in the lives of children around the world. Totally agree. And I'm just making a note as you were speaking. I learned lots of things. Grande Bian, Mikuna, Samaki, Salama. It's just really, those are, I don't know that language, but when you translate it, those are simple words, but, with deep meaning. So we have several questions here. And I want to start with one of my own question. Will you please elaborate on the importance of dietary pattern research and how that might be related to climate change and environment?
Sure, thank you. I also just want to say a word because the slides were showing her name. Dr. Susan Vorkupper was actually an alumni of WashU and did work with my lab. So it's really nice to see her and to see that she's playing such an important role. So thank you, Brahma, very much for that question. I think in the history of nutrition research, we've had a real emphasis on single nutrients for many years. And it's in part because, you know, it's easier, I should say, to do a randomized controlled trial with a vitamin A supplement or an iron supplement and to see the health effects from that using placebo control, for example. But the reality is that we eat foods, and not only that, we eat within a dietary pattern. And I think that's the next step as we move forward in nutrition science and prevention science, is to really think hard about what's going on within that pattern in terms of the interactions of nutrients and the bioactive factors, the so-called gray matter of food that we haven't yet characterized. It's very important to consider the entire pattern. And then with regards to the second part of the question, which is sustainability, I think even in the context now of, you know, as the world engages in COP29 and thinks really hard about how we're going to mitigate and prevent future declines in planetary health and the environment, we have to think about our food systems in the context of sustainability. So what we're interested in for my lab, in terms of a dietary pattern, is can we source foods locally? Can we source them locally, but can we also source foods that comprise or constitute a healthy dietary pattern that come from native plants, animals, and fungi? Can we find a constellation of foods that are sourced locally and produced sustainably? So I think it's a really important question, and thank you for raising that.
Thank you so much. I think that's a great point. I think using the foods locally available will be more cost effective, and also I think sometimes it's the quality will be better, and also you'll discover many of those nutrients that you haven't already realized. And great point. I also want to acknowledge Susan is our colleague who organized global food insecurity webinar series last year. I'll try to put the link. It's a seminar, three seminar series, I think. So if you have missed that, please go back and take a look at them. It was a great discussion on global, food insecurity. Okay, so our next question is here. I want to take one from the audience. In Samaki Salama study, the target audience was the families or the children? Was it focused on the household mothers? Can you explain a bit more about what was the audience segmentation and the implementation of the strategy, of the Samaki Salama strategy?
Sure. This is why I love the Q&A session, because I get to elaborate on some of these trials and you raise such good questions. So for Samaki Salama, we actually targeted the entire household. We involved mothers, particularly in a household dialogue. So our intervention, there were community health workers, went into the households and engaged in dialogue around young child feeding practices and any barriers or opportunities that there might be to introduce more animal source foods, in particular the fish, coming from the fish. And then interestingly, the fathers very much wanted to be involved in the child nutrition, even though they were targeted for the fishing traps, the sustainable fishing traps. they cared very much about their child nutrition. And I think this explains why the take-home catch was so significant. I think in terms of audience segmentation and the nuances of the social behavior change, one of the things you have to get right in public health is the right team around you doing the research. And you have to think about team science being interdisciplinary. So we involved a specialist from Elevate Nutrition. It used to be Advancing Nutrition, a USAID project. And Lisa Sherburne, she was an expert in social behavior change. I am not, but she was. And so the design of this social behavior change strategy was so thoughtful and carefully constructed, coming from a year-long worth of formative research to develop the intervention. So great question.
Thank you so much. We have another question here. Can you comment on the next steps? How do we work with the communities in the study to implement the change that we have discovered? I think you talked about a little bit in the earlier, but go ahead.
Yeah, another really good question. I think part of what one wants to do when you do intervention research, I feel that this is really important, is you have a formative research phase where you really pilot test different strategies, different interventions to see whether or not there's going to be acceptance on the part of the community and whether or not it will endure into the future. And that's pertaining to your question, which is by designing an intervention that will endure, you have more likelihood of it lasting. So the eggs in Ecuador, for example, we knew there were lots of chickens. And in fact, when we went back a couple of years later, many more children were consuming eggs. One of the more intentional ways that we have structured sustainable and scaling in our studies is by working within the healthcare system. And that is true in all of my studies, actually, in all of my countries. So when you work within the Ministry of Health and the community health worker system, there's also a higher likelihood of impact and sustainability. So, for example, in Kenya, the community health workers were involved in the household dialogue and the social behavior change. And some of that is now integrated into the community health worker practice. I can see Dr. Rayton has raised a hand.
Go ahead, Dan.
Hi, Laura. This was great. For those of you that may have been aware of the implementation science webinar we did several weeks ago under the auspices of the Interagency Committee on Human Nutrition Research, one of the targets is how do we determine how implementation science research is being used and where the needs are moving forward. So my question to you is, you're really focused on the intersection of food, nutrition, and health from a translational point of view, but at the end of the translational continuum is implementation. So how are you informed by implementation science research, and what would be your suggestions for areas that we might need to move forward with to improve that area of research? Thank you.
Yeah, I think, again, very important question. And certainly implementation science is growing exponentially. And it's a critical area of research where we are more likely to have impact. WashU has a big group of people who are experts in implementation science. And there's a real commitment at my university to this field of science. I'm not an expert in it, but it has always been natural in terms of how we think about our research, again, embedding within the healthcare system, involving policymakers very early in the process so that they are part of the design and part of the translation later on. I think, Dan, in terms of the question on, where do we go from here with implementation science? I think those contextual differences are critical in implementation science, and the global work is pretty vital for that. I couldn't say, it's part of why I really love doing global work, is because you have this opportunity to look across different contexts at the different barriers and opportunities to translation of your evidence into practice and policies. So there's a lot that implementation science has to offer in terms of the processes that we go through to ensure our research has impact.
Great, thank you. Thank you, Dr. Iannotti. So I guess I should put in a plug again for Global Food Insecurity webinar series. There was an entire webinar that Susan organized on using implementation science to address food and nutrition security. So please take a look at that. Let's see. I have another question here. Can you please share more information about the use of ultrasound in your field studies?
Yeah, sure. Thanks for that. I aspire to, and my lab aspires to, thinking creatively about different methods and ways that we measure the impacts of nutrition. Obviously, I'm very committed to the field of nutrition and food security. And I think the more methods and metrics that we can use, the more evidence we'll generate to show the importance and the effects of nutrition. So the ultrasound, I'm working with a pediatric radiologist, Dr. Jennifer Nicholas, and she's at Cincinnati Children's. She used to be at WashU and now she's there. And she's just a terrific collaborator, thinking very creatively about the application of radiology to our field of public health nutrition. So she has created with the field teams. We also have terrific technicians and scientists, radiologists in our countries, in particular in Ecuador. And they have together created new protocols and measures to use ultrasound to look at different parts of the brain. So measuring brain morphology to see if there are any differential effects coming from nutrition. And in fact, we have these very early findings showing that those subcortical regions may be influenced by nutrition. And as the child ages, so, you know, at a certain point, the fontanelle closes. So that's our window using ultrasound. It closes and we move into looking at bone development and bone maturation. So we have, Jennifer has developed some of those protocols for the wrist and the hand to see at if nutrition is influencing bone maturation. It's a non-invasive, very field-friendly. You can take this to very low resource settings, like Haiti, for example, and look at beneath the skin effects of nutrition that doesn't require necessarily drawing blood or invasive measures. I think Dan has another question.
Go ahead, Dan. Thank you. Thank you for that. That's really exciting about the ultrasound studies. We'll come back to you. Go ahead, Dan.
So your talk focused on nutrition. The title talked about food insecurity. I think part of the challenge that we have in the field is the vernacular that we use. So many of us have heard the term nutrition security. In the ecological approach that you've highlighted here, the focus on food security really does deal with the externalities associated with the availability and accessibility of food. How do you feel about the differentiation between food security and nutrition security and how it fits broadly into our agenda?
Yeah, I noticed actually that this was defined and raised in the food is medicine presentation of your seminar series. You know, I think rather than being sort of pedantic about the differences in those definitions, for me, the definition of food insecurity now encompasses nutrition security. I think my work tends to focus more on nutrition security and diet quality in particular, and thinking about accessing really high quality foods. But as you said, it's so important to think about those larger, food production, food prices. Brahma, you and I were talking about that. I mean, the food prices, it's one of the key drivers for whether or not people have access to those high quality foods. So I think these new frameworks that are about the food environment and those different domains are important in terms of broadening and affecting change with nutrition and nutrition promotion too, frankly, whether it's from the private sector or through social behavior change. All of those domains are going to influence nutrition.
Totally. Thank you for that. Actually, on that note, I was going to ask you, in that Samaki Salama study, you talked about social marketing and behavior change. Can you talk a little bit more about what you've done? I think we still have time, right? Yep. Very quickly.
Yeah, so again, I want to give credit to my colleague, Lisa Sherburne from Advancing Nutrition and now Elevate Nutrition. She's really the pro when it comes to SBC. But from my observation, over the years in using this, it's really important to think, across different levels. So, intervening with the same messaging at the household level, with the small fishers through cooking demonstrations, we used that. And we do that in Ecuador as well, cooking demonstrations. That hands-on learning, I think, is really important. But it's sort of all of that audience segmentation, targeted messages, really important, again, for that sustained effect of behavior change in nutrition.
That's true. Sustainment is the key. What you learned, you got to really retain. And
I'll say too, sorry, Brahma, you probably saw in the presentation that in each of the studies, we have logos, and the logos were carefully designed by communications experts. So for example, the Laloon study had a poncho with the indigenous symbols in it. And Makuna had colors that were shown to be acceptable and warm for the indigenous community population there. And Samaki Salama was actually, that logo was developed by students at a local university. So all of that, the print materials as well as the behavior change is all integral to an SBC campaign.
Yes, I did see them, and I'm glad you actually reminded the audience about that, especially in community-based studies. That really means a lot, and that kind of brings the message to the forefront. So great. I just one last question. So I was just thinking, you've done a lot of work globally, and you're also doing some work locally. So based on the global work, and are there lessons to be learned locally to help address the food insecurity, nutrition security, diet quality, any insights?
Yes, thank you for asking that question. I think it's very important to not set up a dichotomy of domestic work versus global work. We're all doing global work. St. Louis is part of a global community. I feel very strongly about that. So there are lessons to be learned on across different contexts. And so we're working in St. Louis. It's a new collaboration to look at early life adversities during those first 1,000 days of life, and learning a great deal from this study in terms of measuring mental health, maternal depression, adverse child events that can now be applied in other places. And similarly, some of the learnings from our studies in Haiti and Ecuador have been applied here. So testing things like eggs here in St. Louis. So I think of it as reciprocity. I think of it as being part of one global community and the importance of that comparative analysis in our science.
Thank you. You're right. I think it goes both ways, and lots of lessons to be learned. Thank you so much for the wonderful presentation and answering all our questions. I think I should turn it over to Valerie.
Yes, thank you
Back
so
to you.
much. So thank you, Brahma. This formally ends our Q&A. This was a very great discussion. If there are questions that you asked in the chat, we'll see about getting Dr. Iannotti to answer those to be included with the webinar recording. Thank you again, Dr. Iannotti. To echo a comment in the chat, your work is very impressive. We are so impressed. Thank you, Dr. Rayton, for the wonderful introduction, and Brahma for leading an engaging Q&A discussion. Thank you to my ODP colleagues, Catherine, Melissa, Teresa, Sherry, James, who all worked together to make this webinar possible and run smoothly. And an additional thanks to you for joining us today and all throughout 2024. As we mentioned before, this is our last Prevention in Focus webinar of 2024, so we hope to see you in 2025. If you're not already subscribed to receive our notifications, be sure to do that. And again, thank you for attending. Take care.